everyone would love if there was more resources available where nobody was ever outside, right? That's like ultimately what we all would hope for and envision. If your program may be limited in what resources it has, how do we work across different programs and agencies to provide the service in the best way possible by sharing resources and coming together and working smarter to serve the people most in need? It's not just giving someone a resource, it's through the conversation, trying to build up any opportunity where somebody is starting to feel that renewed sense of hope. Because if you have been trying the same things over and over or hitting a lot of barriers, sleeping outside, your energy's drained, maybe you're not eating, all these things, you're less likely to take a next step.
Good afternoon again, ladies and gentlemen. This is Lydia Gray from the Missing Peace podcast. I am here with Jaclyn Nunziato. Nancy Nunziato is the director of the program at New Jersey 211. She holds a master's degree from American University in public administration and policy and completed her undergraduate studies at Rutgers University in New Brunswick. She is a dedicated wife and mother, active in church ministry, and an aspired homesteader. For the past 10 years, she has served human services organizations, public and nonprofits, passionately operating programs to serve vulnerable populations. She is data driven, collaborative thinker, and practice growth leadership with our team. Let's welcome Jaclyn Nunziato to the Missing Peace podcast. Nancy, can you tell us a little bit more about yourself? I have introduced you, but you can give the audience a little bit more insights of who you are.
Should have came prepared with a joke. Uh, Hi, everybody. I am really honored to be here with Lydia today and inspired by all the work she does and excited to help people learn more about the organization that I work for, which is NJ211. I myself found myself here unexpectedly. I was in between jobs and I knew I just wanted to help some people. So I started putting the word out uh, what odd jobs, who needs help, what can I come do? And then God had the plan, sent me here. So I've been here for 7 years now, and it's definitely the work I'm meant to be doing.
Thank you so much, Jaclyn. Well, I did not meet Jaclyn directly. I met Jaclyn co-worker at the nonprofit conference in December. She was really excited and told me that she wants to introduce me to her supervisor. Well, lo and behold, Jaclyn and I will say, we had such a good rapport. I Let me give you guys my own mishap that I had with Jaclyn. I had a meeting with Jaclyn on the day when I was doing the container loading. I forgot totally that I had a meeting with her. Well, once I realized, I called her the next day, and she was so accommodating to me to give me a second chance to talk to her. And I am so glad that she were able, because some people would have written me off right away and say, I don't need your time because I was online waiting for you and you did not show up. But you were so gracious enough to do that for me. And in that first encounter with Jaclyn, we spoke for like about more than 30 minutes. And then we schedule a kickoff meeting in which we spoke for like an hour. And now we're doing a podcast. New Jersey 211, I learned, is a program that New Jersey has. And even with Pennsylvania, as Jaclyn will explain to us, it's an homeless line to relocate people who are homeless who cannot find a place to stay, and New Jersey 211 will give them a temporary stay until they're able to get on their feet. I don't know how long that is. It's their program because there must be a limit. We're gonna go through the podcast, and Jaclyn will definitely and give us a true insight and enlighten society about New Jersey 211, which most of us don't know. Even when I spoke to my prosthetic personnel, they did not know what New Jersey 211 is. And today, Jaclyn is going to help me spread the word for New Jersey 211, and so that other people will realize that there are programs out there to help homeless or people who are what's the word um find themselves in a less fortunate situation. So Jaclyn, let me start with this. I don't already did an opening for you, but you want to let me ask you one of the first questions. We have a lot of questions, but believe you me, most of the time we only go through like about five, because within the questions you will answer all the 23 questions in it. So we're not gonna go through that. And again, it's a relaxed conversation. Feel free to throw a joke, feel free to laugh, and we it's really a program where I try to make people feel comfortable and not tense. So we talking to me. It's not an interview, it's conversation.
Mm.
Okay. For listeners who may not know or may not be familiar, what is New Jersey 211 and why does it matter right now?
Sure. So, NJ211 is part of a bigger network of 211s throughout the US, Canada, Puerto Rico. Um, and we are a place where you can speak to a live person when you don't know where to turn. Um, and we help to connect you with whatever community resources are available to kind of meet the need. We have dedicated staff that build out a really robust directory of services. Um, we share data publicly to help inform communities about gaps and needs. And then we have some specialized programs. So in New Jersey, NJ211 operates in partnership with the Department of Community Affairs for a home energy assistance line. And then also we partner with Department of Human Services, their Division of Family Development for the state homeless hotlines program. Um, so right now we're receiving probably about 1,500 calls a day across all of our different lines, and trying to serve those callers as best we can. Um, I would say, why does it matter right now? There's been so many changes and challenges that have emerged probably for the last, 5-6 years, new challenges, new craziness. Um, and I would say in the last, 6 months or so, there's been a lot of unsteadiness in households, which has been just kind of a trajectory towards more unsteadiness over the last 5 or 6 years since COVID. Um, but households, even that are working steady jobs, there's just not enough to make ends meet, or there's some type of emergency that they weren't expecting, and now all of the other pieces kind of fall apart. So we have people calling because they are facing eviction for the first time in their life, or they can't keep the heat on for the first, So a lot of people who have never experienced these challenges before are facing them now. And then, of course, so many people who have been resilient through their lives, and are very familiar with these challenges, still need help regularly to figure out how can I keep going? How can I keep the lights on? How can I make sure my kids have food every day? So we are there when those questions come up and just help to navigate what to do next.
Wow, that's wonderful because this is really a big program that's it's not only in New Jersey, but also it's nationwide and international as well because you mentioned Canada. This is really informative, very informative for people, for my listeners to hear. So, do you have like a resource center where this calls comes in and they answer it? And you have people who you hired live. It's not I'm not talking about if you want to speak to this place here, do you have live list uh,
Yeah.
yes, what the word is coming to my mouth.
Yes. So we have staff 24/7, 365 to answer the call, answer the text, answer the email, whatever it may be. Um, but these are folks who are caring and they want to help, steer people in the right direction. We go through process, an in-depth process of training folks around communication skills and how to navigate resources and de-escalate, challenging situations and crisis situations. So they're well trained and they're very caring and they're real people to
They're
talk
real people. Yeah, that's because again, when an homeless person is calling for for an emergency, because especially look at the weather this past few weekends, and now it's freezing level, it's snow, people are dying, and they need somewhere to stay. And
to.
if they don't have those places to go to, it's gonna be very dangerous for them out there on the streets. So how does New Jersey 211 help folks like that?
It's a good time for this to be scheduled coming off of this big stormy weekend. It's all fresh in our minds. Hopefully you got cleared out already. But yeah, so our state homeless hotline program is designed to help people navigate housing crises. Um, we have a couple different hats that we wear this time of year. So from the state homeless hotline perspective, we are answering calls from people in need, helping to identify what are their current challenges, what have they tried, what are their barriers, and where to turn next. Um, after all the agencies are closed, like weeknights, weekends, holidays, or an unexpected closure like Monday, most offices were closed. We were still open. So when offices are closed, we are able to make placements into local shelter programs on behalf of the agencies that are not available at the time, mainly the social service agencies. And then another hat that gets added on this time of year is for Code Blue. So in New Jersey, we have state mandated codes related to the weather. And so when it drops below freezing, communities are required to make available additional sites where people can just get out of the severe weather because of risk of exposure. Um, but that can be so different in 21 different counties. And so the beauty of 211 is we are listing all of the different counties' activations of those code blues, their warming centers. So that's publicly available on our website, nj211.org. And then some of those resources may not be available directly to a person, just walking in. They might need to call ahead, or we might need to call ahead for them. Or in some communities, they're relying on motels when the local resources are filled up, and we're able to arrange that to coordinate those placements as well. So if there wasn't a place to reach out to, there could be confusion, or people might assume there's not a resource when really we can send them somewhere to get out of the cold.
Yes, because when there is code blue, people go to those designated shelters or hotels. The hotels or the motels are better, but those designated shelters sometimes are not so conducive for those people. Because when I spoke to a few homeless people on the streets, they told me that those shelters put them out at 6 o'clock in the evening and they don't take them back in till about 7, 8 o'clock at night. And so when it's cold, they have to wander around the streets. That's why you see a lot of them wandering around somewhere or sitting in libraries or restaurants that accommodates them or places that they could find some kind of warmth, because most of the shelters does not accommodate them at all, and they may not know that they can have vouchers for motels. I myself had paid for motels for a few homeless individuals that I found on the streets, because it was so bitterly cold, and I, in my conscience as a human being, I would not leave someone being out there in that kind of weather. So um again, I have called 211 and they gave me shelter's name to go to. But when you call the shelter, there is so many process and protocols that they have to work with. And again, sometimes those process and protocols that are in place may not be of it does not create emergency in terms of some of the people that I meet on the streets.
Mhm. Yeah. So in talking about some of those really significant challenges that folks are facing, I'm going to try and break them down. Um, Stop me at any point. But for the first thing that you were mentioning was, where do people go when they have to leave the shelter? But it's still cold out and they don't have somewhere to go to.
Exactly.
Yeah. So most of well, at this point, January, February, the weather is cold all the time during the day. It's like not hitting above freezing. So,
And for sure, this year it's no joke.
yeah, definitely. Um, so those code blue activations also have times attached to them. So in November, usually the protection is just like the overnight hours. This time of year, a lot of the times it'll be longer spans that there's protections. So what that sometimes means is that the shelters will allow people to stay longer, to stay out of the cold longer. Um, but also resources, like you had mentioned, libraries. That's actually one of the things that communities plan for, that people who are unsheltered will be utilizing those public spaces, and they should be able to do that without judgment, because that is the designated space to go during the day. That's what the community is making available. So we list daytime warming centers and overnight warming centers on our site, and try and designate that so it's easy for people to know. Um, but beyond that, I mean, people are also able to go to different drop-in centers and soup kitchens and things like that, not only to get out of the cold, but also to connect with resources and sometimes case management or showers or whatever might be available locally. So we also try and direct people to those resources, which could be helpful in those interim hours when the sheltering is not available. On the questions around the motel, this is always the trickiest. I know one of your questions is, what do I wish people would know? This is one of them. One of them. Moteling can be a very tense question, because everyone would love if there was more resources available where nobody was ever outside, right? That's like ultimately what we all would hope for and envision. Um, our our services through our partnership with DFD is that we are able to make emergency placements, usually until the next business day. And this depends on each county. So if counties have shelter programs, then we would use the shelter programs. If counties developed their services to use motel, that's what we would use. So it's not that there is like a motel voucher program throughout the state of New Jersey that 211 operates. We are working on behalf of those local social service agencies, and really just until that next business day, um, so that they can apply for further benefits or submit extra documents, whatever is the barrier to getting certain services. But it's not it's a small piece of a solution. It's not the whole. It's not what we would all want, right? To be able to just stay. Like, it would be wonderful if we could just make long-term placements for people, but that's not what the program is.
It's and sometimes I don't know. Some of the people I don't know whether anybody want to be homeless or be out there not doing getting a place to stay. But as a human being, you and I are, we have, you know, I work for humanity. Even though indirectly I'm not working for human services, but I do work for human services. When I see them on the streets and being homeless and hungry, don't have food to eat because the shelter don't have anything. The temporary shelter does not give them food. They have to go out there and fetch whatever they can eat for the day. And again, that could be also the manpower and the financial resources, which a lot of nonprofit organizations today are going through a lot of constraints because a lot of us are in a bind, not able to get funding from the federal government to the local governments at large. So, and again, most shelters are closing because they cannot uphold the responsibility of sheltering other people. And then the people who come there to work for them, they are not going to work for free because they have to live as well. And if they don't have the resources to pay them, they would have to close the the system. And that's where I am at right now. Where does the government go from there? I don't want to be, because New Jersey 211 is the government. Where does the government go from there to really house these people so they can have like a permanent place to stay?
Mm. Well, 211 is not a government entity, but some of our partners are government agencies. So for the State Homeless Hotline program, we have a government partner.
Okay.
But to
Who
speak
is your
to
funder? If I may ask that, because
yeah,
I'm learning.
yeah, no problem. So our State Homeless Hotline program is through a partnership with Department of Human Services and their Division of Family Development.
Okay.
I will say, to your point about some of the temporary shelters not having food or things like that, there are a lot of great models throughout New Jersey where the warming centers have case managers and street outreach teams coming in. They have food, they have breakfast, they have lunch, they have dinner. So it does vary between communities what they're offering at those sites, those warming center sites, but also obviously the shelter programs as well can vary. And I would say there's been a lot of uncertainty around federal funding from HUD. There have been expansive conversations and development work throughout the state that is pushing that collaborative mindset of, if your program may be limited in what resources it has, how do we work across different programs and agencies to provide the service in the best way possible by sharing resources and coming together and working smarter to serve the people most in need and try to limit the whatever negative impacts there might be.
Okay. This is very informative. But let me jump to this area now. Access, equity, and inclusion. I know that we are going away from some of those languages in this time of our life where equity and inclusion is no longer, if it's part of a program, the government may not sponsor it.
Mhm.
So how does New Jersey 211 reach people who face barrier like language disability, lack of internet, or housing instability? We talk about it, but you can just give us a little bit more highlights with a direct question.
Yeah. So part of being an accredited 211, which we are, it really puts access as a paramount requirement that we have to be focusing on being accessible. So in some of the ways we do that is, the 24 hours say or the 24-hour availability. But we also have access to translation services 24/7 as well. We hire and recruit people that are English speaking, but also Spanish speaking. Um, and then any other languages that somebody is calling in on, we can use that language line to make sure they're able to express themselves in their native language, to help us, so that we can help them navigate. Um, Disability, I mean, there are ways to call in. So like 711 is a resource people can use if they're hard of hearing to have phone conversations that gets texted out to them. So if someone calls us in using that platform, we can still assist them. Um, Lack of internet. What's really good, so for over 20 years, I think it was like 1996, that the FCC designated that the 211 phone number would be reserved for information and assistance finding local resources. So that's why 211s are everywhere, because that phone number is preserved for that reason.
So
So
that
you don't
means,
have,
okay,
sorry.
go ahead. So you don't have to have a phone connection for you to dial 211, just like you will do with 911.
Um, I don't know about that, but more so like if you don't have your own phone or you don't have the internet, you can still reach us very easily as long as you remember that it's 211. You don't have to memorize a long phone number or have it stored somewhere. It's easy enough to get in touch with us because of that access code, that 211 number.
Okay, because I've met a few um, homeless people who they have a phone, but the phone is not connected because they don't
Mm,
have money to connect the phone line.
mm,
But so what you're telling me is that phone that they had, if they could charge, because most of the time, most of them charge it at the public places that they will be hanging out. And like the library give them internet. So when they're out and they face some kind of adversity at night and they could not find anywhere to go, can they call 211 from that phone that don't have a data? Would it reach the call center?
I don't believe so. I don't
Okay,
think
that's what
there's
I'm
that
asking.
safeguard in there.
Mhm. That's what I'm asking to know whether the 211 will, because with the 911 you can use that phone the phone that doesn't have data to reach 911.
Hmm.
But so now you're telling me 211, you don't know whether, you don't
I'm not
think.
sure. I
Mm,
don't believe so. I know that
okay.
sometimes people who don't have minutes or they're calling from Wi-Fi, they have expressed, concerns about being able to reach us if they didn't have like the minutes left or anything like that.
Okay, so how would the program help for that to be connected to? I've met a slew of them. They all have the phone in their hand,
Mm.
but they don't have no data. They cannot make a phone call.
Phone access is definitely something that we talk about a lot, and experience as a need, especially amongst people who are experiencing a housing emergency, living outside. But we try to direct them to free phone programs, so there wouldn't be an issue of running out of minutes. So I'm not sure how that would play into the story, but we do try and connect people to resources to get free phone services so that the financial piece is not the barrier there. Um, and then just sharing. I mean, people who are in community and, sharing resources already, sometimes they are sharing phones too. So we do get calls from people, and there's like 4 people that are using the same phone. So I mean, there's not an easy, I guess, answer to your question, but that is, I guess, the way that people are still able to access the system, even if they don't have minutes on their phone.
Yeah, because some of them will use their friends, or they will call someone that they know to help them out. This is some of the dicey situation that we face, because most of the homeless people that I and I've come across with, every week they will be calling me from a different number, or those they call me from a friend, and then you call them back at the friend's number is cut off. So I go through that a whole lot in trying to help them as well. Okay, let's continue as we go, because you really throwing a lot of impact here. You mentioned 711. I've never heard of 711. Can you give me a little bit of what 711 is all about?
I don't know too much about it, other than that people that are hard of hearing or deaf can have like a text reader type of phone, and then they access, basically it's an interpreter, through that system, so that one person is talking and one person is text typing.
Okay. Let's get into like real impacts right now. How can you share a story or example that really show how 211 changes lives?
So I would say I'm going to share an overview type and then a more specific person. So from an overview, we just put together our annual report to our partner. It looked like we made over 11,000 placements into emergency shelter last year, 2025. So, even though there are many nights when somebody, there might be some people who we're not able to assist, when you look at the bigger picture, this program is serving quite a lot of people. And for the nights that they're able to get out of the cold, or, have somewhere safe to be inside, you know, we count those as successes. So over 11,000 instances where we're able to successfully emergency house somebody. Um, and then a specific example, we got a really sweet thank you from a woman in December. She just expressed that she had been going through a really hard time, and that a lot of her family and friends had turned away from her. But when she called us, it was our overnight shift, and she spoke to a woman who just really got her and showed up for her that night. They were able to connect, and ultimately we were able to arrange an emergency placement for her. And she was just so grateful for one night's rest amongst what's been like a really chaotic couple of months. So, the next morning she woke up, she had to leave her placement, but she had her next steps. She followed up with the agency that we connected her to. Um, so it's just little moments where we're able to serve a need that otherwise there wouldn't be anybody to show up for her at that, in that moment, 2 a.m. when you're just out in the cold.
I could only imagine what's a bit. I cannot even run outside for a minute with no coat without me saying that, oh my God, it's cold, it's cold, it's cold, for me to run back inside the house and say, let me get a coat or whatever. And imagine them being out there in the cold. It- So with that, I know Niger's NJ211 does not give a transition program where it's a long term, but in, when you look, there are some of them who don't want help. They want to be out there because I have come across them a lot. And then there are a few of them, like the Lingy, who, because of circumstances, of if she found herself on the streets and not having anywhere to stay, how do you transition them into like a permanent place and give them different kind of resources for them to thrive in society?
Mhm. Yeah, I think that that question comes up a lot in our training classes, and we've been making a concerted effort to kind of move into a direction of trauma informed approaches in our work to understand where a person's coming from. Like, I would never want to sleep outside if I could do something not to, but other people are making different choices, and that's different circumstances that someone goes through in life. So, one of the things that is a focus is that like the motivation and encouragement piece of the call matters too. It's not just giving someone a resource, it's through the conversation trying to build up any opportunity where somebody is starting to feel that renewed sense of hope. Because if you have been trying the same things over and over or hitting a lot of barriers, sleeping outside, your energy's drained, maybe you're not eating, all these things, you're less likely to take a next step. Um, you may be less likely to take a next step to get the help because you don't think it's going to work. But even in the example that I gave before, like she had spoken to us before, but it was different when she spoke to this particular specialist and they connected in that particular way, and she felt that renewed sense of I'm going to try again. Um, and then from permanent housing, so one of the you had asked about getting people into permanent housing. Um, because we've been doing well, the homeless hotline has been in operation since 2020. And before that, even we were working with some counties and supporting their homeless service efforts as well. So we have this longevity to see what happens with people to some extent. And there are people who have been calling for years. But then every once in a while, we'll find out about, that there was some type of successful next step where they were able to connect with vouchers or a specific program or, something changed where they were able to get housed. So we are not directly involved in permanent housing for the most part. But then by connecting people to the proper resources in their community, mainly through their like coordinated entry systems are developed so that people who are experiencing chronic homelessness have the have a are prioritized for housing opportunities. So each community um, has those systems in place. It's just a matter of making sure people are connected to those systems so they can access permanent housing vouchers or um, rental units with subsidies, different things um, through those systems that are developed to serve them.
Wow. Yes, that's wonderful because I will tell you this, my greatest I, when I feel like I am fulfilled in what I am doing in my pursuits to help mankind or being out there, mainly my concentration is amputee and physical disabled individuals. When when I see them get up and do things for themselves, It gives me so much gratitude. It's up till this day. It's been about a year or two now when I met a lady in New Brunswick who lost both. She lost both legs and both ends. I would say one end is totally amputated, and the other one she only have like um, um the the knuckles in her hand. And I saw her walking stairs in less than 6 months when I introduced her to my doctor to help her out. The pleasure, the gratitude, the joy that I see and that came over me at the time, seeing her was so gracious because I want to see people get up and do. Not everybody is gonna do it. I am not a person that likes to play the pity party. It does not work well with me. Every day you have an excuse. Yeah, I believe as long as there is a will, there is a way. You have to get up and find the way because you have the will. But if you're talking about the will and then you're not doing anything to find the way, it's not going to happen. You have to be, and nowadays everything is sitting right at our fingertip. We don't have to go anywhere. And so having the number of you sag 11,000, but the impacts that comes through, I know that's what gives you guys more gracious moment for you to say we need to still continue this homeless program, which New Jersey 211. I am, and that's good. And again, we cannot have everyone being coming out and say, "Well, I got it. I'm going to get it done." We cannot have it. Not everyone are motivated like that. But the few that comes back and say, "I can do it," things are working out for me. I am doing well. I want to go to work. I want to do other things. I want to find my own. Again, it's tough out there. Making $20 an hour does not even give you a one-bedroom apartment to stay these days. It's just so hard out there. And that's where I'm coming from because some people are working, but they cannot even find a place to stay because it's so difficult. And the government voucher, um, let me say this, it is so political, the government voucher to get something. I remember one time my sister put in for some of the low income, with the longer law, they have to get, every new builder has to provide at least, is it 10% of their building to
I
low
think so.
income individual?
It's part of like the affordable housing requirements for each county,
Yes.
depending on whatever their numbers are, is how they determine the percentage. Yeah.
And she went, she had put her name in the list for a long time. She went there, they told her name is not on the list. And she has been constantly, and again, it's who you know, and that's where I'm not saying that who you know does not work because again we all go with networking because we want somebody familiar, but it's so difficult when you are alone and you don't know nobody and you're
Mhm.
looking for something and you cannot get it and then you still out there struggling while you're walking, and that's why some people give up
Mhm.
because it's a difficult, and you can if you can, if you're working $20 an hour, you cannot even pay $50 a night in motel because they don't even have one for that price. And again, you're working for to sleep in a motel because the voucher program is temporary. But I am my saying is the government or the different program odds or things like that should try to see where they could help people in desirable situation to get some kind of place to stay, like container homes or and so forth and so on. I don't see a lot of them here in New Jersey, and it's a thing that to start going. But something that would help these people to stay out from the streets. That's what I am saying. Let the program be out there and let them say they don't want it, especially for the ones who don't want to be out there but cannot afford the situation.
Yeah, I mean, I think
System does
that
not help them.
our existing system of, what government funds can cover, there's a lot of restrictions on how those vouchers can be used and what type of housing they can cover and all of that stuff. So I think you have a good point that there has to be innovation and flexibility to really meet the needs.
Yes. We're doing well, Jaclyn, and this is going so well. The information that you have provided for me, it's so good because, and again, if I ask you any question that is against or go beyond what you want to answer, please feel free to say no, or this is something that you're not, in the position to discuss.
Now you got me nervous.
No, I'm not. I'm not. I'm just. I should have given you that disclaimer in the beginning. And now I'm coming to where your partnership and system is. How does New Jersey 211 collaborate with nonprofits like mine, healthcare providers, and government agencies?
Well, partnership is in our name. We're called the NJ211 Partnership. And I would say that a big part of that is because we want to make sure that there is information for community members of where to turn. So that requires that we are working closely in communities, that we can be trusted amongst nonprofit providers and other types of services in each community to say, yeah, we want to be listed. We want to get referrals of people who need help from 211 to us. And that does take a lot of relationship building. We have presence in all the counties in different capacities, and that's been a focus of the organization to make sure that we are there, whether it be in person at events or at standing meetings, to share data, to talk through barriers, just to keep a pulse on what's going on. But I think that for us, that's so important because we want to help the helpers. If communities have strong programs available, then we could connect people to them. If there's not resources in that community, then there's not much we can do. But there's so much good work, and having met you, like there's so many little like gems that we weren't even aware of. And by making connections and relationships, and I know just in some of our conversations, like being able to identify other programs or services and sharing them with each other to keep growing the awareness has been important. So, from that perspective, just sharing information and keeping a pulse on what's going on, that's a big part of our partnership model. And then we know that healthcare has been a growing area of development. So there's a lot more going on around like social determinants of health and how healthcare providers and hospital networks and all of that are starting to integrate how important it is that people have access to nutrition and all of the things they need. So we're trying to just continue to have open relationships and conversations with healthcare entities. I know hospitals, especially during this time of year, are always interested to talk about, code blue and homelessness because wherever there is a struggle or a challenge, we're open to having a collaborative conversation to try and make things work smoother. Um, I don't know if that answered your question, but that's hopefully.
Yes, if you answered my question because again, you guys are doing what you're able to do at the best of the capacity that is provided for you guys. And it's what you can do what is what you can do.
I
You
mean, I
cannot.
think we actively seek out new partners as well. So a lot of our efforts in terms of development efforts over the last year have been around some of the transportation barriers and transportation access. So, just smaller relationships and programs that we do have operating to help address transportation barriers in certain communities. So we try to be strategic in what programs and that we look to develop. We work closely with our government partners to understand where their pain points are and see if we have a solution. We have an interesting partnership in the city of Newark. It's a technology kind of relationship where they needed street outreach. It's called Path Home. It's an opportunity for people in the community to connect people who are unsheltered with street outreach teams. And we provide the technology behind that. So there's a lot of innovative ways that we build partnerships. Um, and I think that's the beauty that we're willing to be collaborative, innovative, and flexible.
Well, I want to say, I want to commend you and Michelle for being, I would not say we are complete partners because I am more on the informative area where I meet people and say, there is a program called New Jersey 211 that you can utilize to help you and call them. It's not just putting you in a shelter for when there is code blue or when you don't have anywhere to sleep, but there are more things that they can do to direct you to other resources that are out there. And like I said, again, I said that we're not gonna ask all this question, but I think we have asked more than what's on what I had provided for you because there is so much to talk about in this in this podcast, and even with the future innovation that I would like to talk about. You've already mentioned it because we talk about the housing, having like container homes, and the New Jersey, what's they call, I call it the lawyer law, but we call it the affordable housing. So, and again, I want to um touch on the Affordable Care Act because a lot of this one of my homeless person that I met has also on a make that was growing so big. I was so concerning. It was really concerning to me at the time. I know I will talk about healthcare just now, and there is some kind of collaboration with when someone called and said, I am sick, I don't have a medical insurance, and what can you do to help me?
Mhm.
And some people don't even know that they can go and get affordable care because the alarm in our society today is it's not good, it's very expensive, you cannot afford it, don't go, don't do it, you're going to get a lot of big bills and all this thing. I'm not being political here, but I'm just speaking the truth that it's what you say, it's what people listen to. And if you're having a lot of weasel words that is gonna give you some kind of fear, it's difficult. So how do you help those people who think that they cannot get any kind of medical, but they're out there dying? And I'm talking about American citizens. I'm not talking about now. Again, I wasn't born here, but I am a naturalized citizen in the United States for, for God knows how many, maybe over 30 years now. But at the same time, I just want to understand for the ones who are even born here that don't even know that they have that kind of resources that could help them.
So one of the important aspects of our resources is that our database team takes good care to make sure that it's very clear about who they serve, what it costs. All of our resources are either free or very low cost type of resources. That's part of the requirements for being in our directory. So when somebody does call with a medical need, we are able to provide resources that do not require health insurance or that have sliding scale fees or charity care options, and helping to educate somebody about what those resources are. I mean, mainly, clinic, what do they call them? FQHCs, um, local clinics that don't require payment, things like that. We want to make sure people are aware of. Kids can get free dental services through certain programs, all of these things that someone might not be aware of, but like you said, might be resistant to even seeking health services because they're afraid of the cost.
Yeah, because the hospital will send them, because when they go to the emergency room for something that is so it's detrimental to their life, and then hospital send you a bill of $10,000
Mhm.
for just being there for 5 hours. It's really, and you don't know what $10,000 is.
Yeah.
Most of them don't know what that kind of money is in their lives, and they don't even know that they could get medical. I remember when I was auditing the university hospital in Newark, and the 911 call that they were coming was coming in from the hospital was coming as pseudo numbers, because they don't want to give their social security because of the payments associated with their social security. So
Mhm.
instead of that, they will come and say they don't have social security. When I took those vouchers at the time, because during when I started auditing, everything was on paper. And when I took those papers and then I am going through them, 60% of the papers that come through don't have health insurance. And some they treated them and then they were sent away because of they don't have the health insurance. And some of them don't even know that they could. Even the university hospital in Newark is one of the state hospitals. And people don't know that it's the state hospital. You can go there, they will treat you, they have resources that could help you in so many. I think that's one of the only states hospital that is still around. I don't know, because well, I was at the time I was working for Rutgers University, and so I should know because I was doing healthcare auditing. But it's difficult because once people don't know that their some of their rights or what they can get, and again some of them have mental health issues, and because of their mental health situation they're not able to understand how to be directed to the right resources.
Mhm. Yeah, part of our questions, like our screening questions, does ask about health insurance because even if someone is not bringing that up, um, it can be such a big influence and barrier in their life. So we do just ask to see if people are covered, and if not, point them in the direction of either applying for Medicaid or exploring other type of insurance resources through, like you had mentioned, the ACA. So New Jersey has easy, simple process for applying for those healthcare benefits and helping people get the coverage that they need.
I want to ask you a question before we close. If New Jersey 211 did not exist, what would that mean to individuals and for the states as a whole?
There's probably quite a few. The first that comes to mind is just a lot more uncertainty of where to turn. I mean, one of the most beautiful things of the organization is just no matter what you're calling about, we're going to try and figure out where to help you turn to. Um, if you're Googling something or you're, um, asking a friend for their opinion on your situation, you might not find all the different avenues. We'll talk to somebody about how they wound up in a circumstance or um, just exploring what other um, factors might be playing into their current crisis. Because by addressing, the more holistic concerns of a person, then it's more likely that they'll be successful in moving forward. So just being able to help people navigate to where to turn next, having that centralized piece is important. We also play a huge role in disasters, so I wouldn't want to see, please God, we don't see disaster and not have an NG 211. Because when things go left, we're still open. We're working really closely with OEM or DOH or whoever is the guiding entity for that type of incident, and being able to provide that clear information and guidance to the public is so essential. Like this SNAP disruption that happened at the end of last year, people could come to our website and easily find food resources and the latest information about what was going on, and pop-up sites where they could get extra resources. Code Blue we talked a lot about, but having a place where people can turn for that type of information in a really centralized, simple way is critical as well.
That's good. That's great. That's great. Um, so now I'm gonna close because I know that we're running out of time right now with 105. But I'm gonna ask you two questions in one in closing. What should every New Jersey resident know about New Jersey 211, even if they think they will never need it? And how can the community member, organization, and policymakers support and strengthen New Jersey 211?
First thing is that everyone should know that we exist, and give the number out to the people you care about so that if they run into a challenge, they have it. Um, you never know when you're going to need help. So, always we're available, we're confidential, we're 24/7. On the partnership, development side of things, I think just knowing that we are innovative and collaborative, we're not stuck in any type of old way. We're very open to partnership to solve these big complex challenges. And we are focused on the people who need help. So all of our programs and all of our new partnerships and all of that, we're trying to make sure that everything is centered on the client. What questions are we asking? How's that going to help them? Not necessarily the funder. How is it going to feel for the person to be divulging certain information? We're thinking about every program from a client perspective. How is this truly going to impact their life positively? So we're definitely open to new partnerships and actively seeking them.
Wonderful. So let me close this out. So how would New Jersey 211 impact my organization, Lydia Amputees Foundation, b- because I am dealing with amputees and disabled individuals, with physically disabled individuals. So how would Mejazi 211 help me become more impactful to my organization?
I'm gonna make too many requests of you, but I know I know just from an education standpoint, it's important for our teams to better understand the population you serve. What are things that we have no idea about, and how to best inform a person, or what questions would be helpful to ask somebody who has experienced an amputation, um, to help them, move forward. So I think education wise, I'm very eager to help our staff learn more about the needs of people who have experienced amputation, and that we can better serve them. Um, you and I have talked, about how we can share kind of what we're seeing, what we're from a data perspective, like where the needs might be, to help in any of your outreach search efforts and development efforts. Um, and are just making sure that people in need know about our services, seeing how we can help people, and even just clarify, this is what we can do, this is what we can't do, is helpful, because there's a lot of like myths or misunderstandings about what you get when you call.
That's wonderful because I do get a lot of people who are in desperable position and they cannot afford. They might be able to afford a place to stay, but they cannot even afford a meal. They cannot even afford to pay their light bill, which are all essential to mankind, to the to our daily living. And I will direct them to New Jersey 211. And again, with your connection, Jaclyn, I know now that I will be able to have more resources available for me to answer when next I meet someone who say they want something because they are in need of housing or they are in need of any kind of program. They are hungry. They don't have anywhere to go or no place to live. I will be able to say, well, let me call someone that I have on their phone number is at my fingertip. I could call and ask them, what can I do? What can I say? And how can I help them? Because I have been through that dilemma before where I am not able to help those people because I don't know where to go. I end up taking money out of my pockets to really give these people so that they can have some kind of stability for
Mhm.
a little bit. And again, it's draining my energy when I think the government should be the person helping the people. I'm helping, but the government should be more of the spearheading organization.
To the point you just made, I think that it's really important to be thinking about, you know, there are good Samaritans who want to help somebody for the night, right? But we want to make sure that that effort is a connector. It's not a gonna drain somebody's pocket, right? So, um, making sure that we are tapping in all the different pieces to get that person the help as fast as possible, that connection to further help. Um, it makes it all the more impactful. You don't want to put somebody up for one night and then they're going to be outside the next night. You want to put somebody up and know, okay, we have a plan for tomorrow, or prevent somebody from getting evicted or whatever it might be, to have less of those bouncing between crises.
Yes, that's so important. And that's exactly what I am talking about. Well, Jaclyn, it's been a pleasure. I am good and glad. I am grateful. I appreciate you and the team of NJ211. I am calling it the Jazzy 211, but when I listen to you, you're calling it NJ211. It's, it's been a pleasure, and I thank you for taking this opportunity. Well, I am taking the opportunity for you to be here today because NJ211, it's vital, it's important, it's one of my greatest resources that I could utilize to grow Lydia Amputees Foundation and the Missing Piece podcast. Because the Missing Piece podcast is talking about what's missing in our lives. NJ211 is not just for homeless or individuals with disability or any kind, it's for all of us. We never know what may befall us tomorrow, and we need that kind of help to get on our foot or feet again someday somehow. Because I have met people who said they have it all, and all of a sudden one day something comes their way and they find themselves on the street and for some reason or the other. But NJ211 is a broader array to help everyone in New Jersey at large. And not only in New Jersey, but to also help other people in other states. Because if you reach NJ211 and then you say, my sister, my brother, my cousin, or I know someone in Florida that does need somewhere to stay and does not have, they might have the contact or the resources available for that person to have that kind of resources to meet, to reach that, to help that those individuals that may not need help, not just in New Jersey, but in other states. Well, Jaclyn, thank you so much. Thank you for being here. Do you have anything to say to close it out?
Just thank you so much, Lydia, for having me, but also for all the work that you're doing. I know that you are putting everything, all of yourself, into helping others, and it is so inspiring, and it brings new life and energy into my work, certainly, every time that we speak. So, best of luck with everything that you have going on in the coming months, and with the foundation, with the podcast, with traveling, and speaking to new audiences about the needs and all the advocacy that's needed to better serve the population. So, thank you so much.
Thank you too. Thank you very much. And thanks to my audience. Thanks for tuning in into The Missing Piece. Don't forget to follow, subscribe, and leave a review. Your support helps us reach more listeners and amplify more voices. Until next time, keep finding strength in your story.